Well, good morning, everyone. It has been such a fantastic morning, and this is a topic that is very near and dear. And why? You know, we get to do something in healthcare, and some of you have heard me talk about this before, but we get to impact people and their lives. And when you think about what we have the opportunity to do, there's literally no other industry that can say that they are with someone on their journey through conception, through birth, through health, through living, and then ultimately through death. And so we see them every phase of the way. And as we think about the addition of technology, I'm super excited, and the evolution of technology, I'm super excited for you to hear from both Dr. Moyer and Mary. And so if you could both just give a couple seconds on your backgrounds and why you're so well suited for this topic.
Well, by chronological age, I'm probably not well suited for the topic. I'm a PGY 40, which means I'll have my 40th medical school graduation next year. And thanks. So I've lived through a lot of different eras of medical education, you know, and now we have sort of this whole new AI and generative AI, something else that folks need to, quote, add to the curriculum. And I am trying to bring the new and younger person out of me to say, no, we have to stop looking at this as here is something else we have to do, whether it's undergraduate medical education, the education of our other healthcare professionals, that we need to figure out how we mindfully integrate it, because AI, as I think of it as augmented intelligence, is another tool in the toolbox. And how do we get people thinking about this early on? And how do we make sure that as we are, you know, flying the plane, as we are building it, very similar to what happened with the deployment of electronic health records, how do we make sure that we get this job done in a way and that is going to be successful in the implementation science? Because I think that's where we get stuck, is we have all of this, and now how do we make it functional, eliminate burden of frontline clinicians, and improve patient care in an equitable way? So I think about this a lot.
I love that. You know, I think it was Bertha this morning who used the same flight sort of analogy as the co-pilot that AI is, and leveraging it while the plane is in flight as another tool. And so we're definitely going to unpack that some more. Mary?
Well, speaking of co-pilots, I am at Microsoft, and our focus is really developing a fleet of clinical co-pilots. You may not necessarily think of Microsoft and associate it with healthcare, but Microsoft actually acquired Nuance Communications, and Nuance is the land of Dragon, DAX, PowerScribe, PowerShare, and soon to be an ambient solution for nurses that we're working on. And so really, for me, I started my career as a pediatric nurse and worked in a lot of different kinds of technology roles, and also in health policy. And we're just at an astounding era right now, full of potential, but also requiring significant pragmatism. And I'm just very excited to, you know, all of what I've been hearing earlier too, I'm just thinking about, we are in early innings, but you know, when we were listening to the conversations earlier, there's still so much to be done. There's a saying, you know, people often underestimate people overestimate what happened in the past year when they think about progress, and underestimate what's happened in the last 10 years. And if you think about 10 years ago, we were still very much in the throes of meaningful use. And we're just in a very different place right now. I think that's, you know, astounding.
Let's actually stay there for a second. You mentioned Nuance and the notion of ambient. Let's look at this from the patient perspective. There's about to be a third person or persona in the exam room. And you could call it Chat GPT or anything, but how do you deal with the situations when the patient is there, they're leveraging their ambient technology, and they're discounting what you're saying as the clinician? How do you build, Michael started this morning talking about trust. How do you build trust in an environment where you've got someone who's disagreeing with you, and it's on their device?
Well, I mean, I think we all know that trust is hard to acquire, but it's easy to lose, right? I still practice. Even though I help to lead the American College of Physicians, I still see patients in the most underserved area of Philadelphia, North Philadelphia. I'll be there, in fact, next week. And I think that that's really critical. And what's challenging is the fragmentation of our healthcare system into an episodic, transactional system has not fostered those longitudinal, trusting relationships. And many of my patients walk in and they have had a very different lived experience in healthcare than the average person in the United States. They're people of color, a lot of women, and so it takes a long time to build that trust. And I think at the same time, we need to be better, whether it's the undergraduate education for our healthcare professionals, their graduate medical education, and in their practice, of teaching people what science is and what it isn't. What it is a constant iterative process that evolves. We are not being wishy-washy when we make new recommendations. And the analogy that I like to give to patients is that if we were treating cancer the same way we were treating cancer 5 or 10 years ago, a lot of our patients wouldn't survive because the field has evolved. Personalized treatment, markers being used for targeted treatment. And we're not being wishy-washy. We're following the science and changing recommendations. So I think we need to be better at paving the road for our patients. And I have a lot of patients that are very hesitant about vaccines for a variety of reasons. And it takes me not one, but sometimes 6 or 7 conversations. So we just have to hang in there. We need to understand what is important to that patient and be receptive of their story, because I think the data is we allow a patient to talk 16 seconds before we interrupt them. So I think we need to make sure that health systems are giving the opportunity for those relationships to flourish.
Love that. Absolutely love that. Mary, tell us what Microsoft's doing around misinformation, because a lot of this attempt to educate, inform around the practice of medicine is so misunderstood.
Yeah, so I think, so I know we're talking about AI right now, but if you actually go back in history, we had not a dissimilar situation, in the mid-90s with the World Wide Web and patients going to Dr. Google and getting all kinds of information. And then it went to, mobile and social media and all of these sorts of things. And so I think AI is just another layer of technology evolving. What Microsoft is doing is, we're part of a number of different consortiums, really thinking, really helping. And I really think of it as more of a movement. So we were talking about TRAIN earlier. TRAIN is the Responsible AI Network. It's a number of different health systems across the country. But we're really talking about what is the scale of maturity? What is the culture? What is the governance? How do health systems think about the guardrails, the clinical guardrails? How do you think about just the way that the AI is developed, but also how the models are monitored when they're in use? There's a host of different things that need to come together. So when you think about the journey that health systems were on, just adopting EHRs, then the journey to move to the cloud, to get to digital, the same level of just organizational evolution is going to be required with AI as well. So I think it's different, but it's also the same. Like, we've been here before, the flavor is just different. I think the pace of adoption for us as individuals and collectively as a society is ramping up, which I think is good, because it helps us really lean in and see what value can be derived in healthcare. It took Netflix 10 years to get to 100 million users. It took WhatsApp 3.5 years. It took ChatGPT 2 months. So we are getting faster at adopting and adapting, but there are other things, of course, that need to come along with that.
Let's stay there. This morning, you and I had a fantastic conversation around the digital natives, now interns. And you were sharing a great story. Maybe you could share that story and then parlay into adoption and utilization.
Well, it involves this little handheld computer. I find myself in the past several years with new interns in the practice. And we see the patients together. I see every patient with them, and I, of course, want to hear about what they think is going on. And they're like, well, I think this person has coronary disease. And they tell me a few more facts. And we talk about, Bayesian theorem, right, and probability. And I'm picking up the phone and calling my friend, the interventional cardiologist, because by pre-test probability, this person needs to go to the cath lab. Like, don't stop and do anything else. And for goodness sake, don't just put an order in the EHR for a cardiology consult and expect that something miraculous is going to happen. And the intern actually said to me as I was dialing the phone and calling the interventional cardiologist that was on call, Dr. Moyer, what are you doing? Who are you calling? I said, well, I'm calling the interventional cardiologist because we need to get this person over to the cath lab and get evaluated. You can do that? Incredulous that we could do that. And I think it goes back to, just like there's no algorithm for empathy, right? There's no algorithm for contextualizing sometimes the severity of a situation and understand that it's those human connections that are going to help that patient.
What do you think we're missing? In some ways, to have to explain that is almost a bit of a head scratcher, but we can easily get lost in the technology. I was sharing that I have an 18, a 16-year-old, and if I communicate via text with them, I may as well wait a couple days. If I text anyone in this room, I guarantee you, they're probably getting back to me within seconds, but she's 18 and the other one's 16. If I put it on Snap, or if I put it on Instagram, I will get a reaction in like a nanosecond. How do we, it almost seems like we shouldn't have to, but how do we begin to remind people why we're here and what we're doing and how precious that connection is between provider and patient, consumer?
It's a great question, and I think it comes down to you've got to do right by the patient. You need to understand the communication style of the generation that you're dealing with. We've got 4 generations in the workforce right now. So it is really challenging, but we need to understand that. But we also need to make sure folks understand the tenets of professionalism and bioethics as they are in their undergraduate, graduate training careers. And that, first and foremost, that, despite the world moving on, that's one thing. Putting patients first is one of the major tenets of medical professionalism. And we need to figure out how we get folks' attention to make them understand that it does come down to humanity and having those person-to-person conversations.
Mary, how does an organization, a massive organization like Microsoft, or maybe not so massive, maybe like many in this room, venture startup, how do you all view this conundrum? How do we approach it? How do you approach it?
I think part of it is also reframing. I always think of technology as an enabler. In this world of AI, it's such a frothy market, and everybody is looking for a business idea around leveraging AI. And healthcare is an industry where everyone is focused because there's so much value to be created. I think it comes back to the use case. Like, is there a use case? What is the pain point you're solving for? Maybe it's AI, maybe it's something else. I agree, it's also really adapting to how technology is used. So you're talking about your children, and it's about meeting them where they are. It's about meeting patients where they are. I've been just so excited to see, and I know it started with the pandemic, it took us so long to embrace telehealth, and then we had to in the pandemic, and now I'm seeing virtual nursing platforms, finding ways to remote in experienced nurses who've left the bedside, changing sort of, the care models, healthcare in the home. This is using technology in a way that we were really kind of slow to adapt, and we were kind of provincial, and this is the way it happens. You come to the hospital, the doctor is there, and sort of the doctor's at the center, and we're really using technology to put the patient at the center. So it's about that human connection. When we think about the work that we're doing, it's around removing that keyboard between the patient and the provider in those care settings. What we're doing for nurses is, Our vision is if a nurse can just speak, and the documentation is just a byproduct of the care that he or she's delivering, we can do that. The technology is finally here. It's about really honing those applications, but changing the way that we're actually navigating the healthcare system as people who work in it, people who receive it. I've always found this to be interesting. We all have such a higher bar for the experience that we have with technology, with Uber and Netflix and Resi, than we do when we go into an EHR. I mean, and sort of the systems that we use. I mean, it doesn't look anything like modern apps that we use. So there's a lot of room for growth so that we also can experience our own technology as people who work in the healthcare system to be much more intuitive than it is right now. And I'd also say, I think about this, clinical judgment is just the scarcest asset that physicians and nurses have, right? If they have the mind share and the lack of cognitive burden on that's being pulled because of a billion other things that have nothing to do with getting to that clinical judgment, if we can free them up, if we can serve up information so they're not searching through screens and screens to look at when the last hemoglobin A1C was or whatever it is, that's the opportunity. So it's really around, when I think of Copilot, it's around how do we really preserve, how do we bolster, how do we strengthen the ability to make that clinical judgment wherever they are in their workday.
Yeah, to your point, I mean, I think about, we were working on telestroke programs 15 years ago. I was with some massive cart, and you think of how long it took to grow adoption there. Hospital at home, that was an idea from the 80s. It's just incredible to think about how long some of these ideas take to take place. How do we speed that up? How do we, everyone here is searching for this notion of velocity, particularly when you come up against the sort of delivery side, because it tends to move a little bit slower. What do you think about that?
Well, I mean, I think we wrote, our medical informatics committee wrote a paper, it was published a few months ago, about the role of AI in healthcare. And I think it all starts with the governance. The rules of the road that underpin our organizations, our systems, are critical. We're thinking about accountability, the implementation science, privacy issues. What about the deep fakes and what happens, when people are using AI for nefarious purposes? And then, of course, all the climate implications of AI. So I think that we really need to foundationally pave that road appropriately, because I think once we go down the road, we're not going to really be able to pull back. So being very mindful about our structures. But the last point I wanted to make is data is critical here. And we have seen the bad things that have happened with the facial recognition algorithms and the discrimination. The discharge algorithm that was based on Medicare payment rather than actual care delivery, that was extraordinarily biased against people of color and of low socioeconomic status. So if we don't have the right data, it becomes garbage in, garbage out. The veracity of the data is critical. And the last thing I want to say is we have to push the payment system to start to pay for these things. Northwell and other systems are doing incredibly innovative work. Hospitals, note to everyone here, hospitals are not always the safest places to be for patients for a variety of reasons. So we need to make sure we push the payment system to get to more value-based, innovative care models and getting right care, right patient, right time, right setting.
Dr. Moore, you touched on so many hot topics. I could get comfortable up here and be up here for hours. Thank you. The data and whose is it? Is it mine? Is it meaning the provider side? Is it the individuals, or is it some third party? Just a great topic. And then the payer system and how it tends to lag behind. I mean, probably that's one of the reasons why hospital at home never took sort of grip in even the 90s and early 2000. Let's pivot a little bit and let's talk about education. I don't want to sort of leave this topic of the human element without talking about it. One of the So our dean of our Zucker School of Medicine, Dr. Dave Battinelli, is here, and one of the novel things they did at the time with our medical students was putting them on the ambulance right at the start of their medical education and training. And that was largely so they could see the individual in their most vulnerable state in their home and see what that health environment, or maybe lack thereof, looks like. When you hear something like that, what advice would you have for Dr. Battinelli in terms of where else they could be coming up with novel ideas as we think of this interface of technology and the human being?
So, I think that there's, again, just like we did with the cloud and digital and everything, there are roles that are getting created or are now very much in health systems, like Chief Medical Information Officer, Chief Nursing Information Officer, these roles. Those scopes are going to get larger, of course, with like the proliferation of AI. But there are new roles like prompt engineers. I mean, I'm hearing about health systems that are hiring clinicians who are also engineers, unicorn. And then they're really thinking about what are the prompts that are actually the ones that you're going to ask to actually have a better sense of what's the best thing you can do for this patient, and then how do you disseminate that almost as the learning networks of that we used to really kind of push, and how do we best disseminate best practices. So there is all this work that's underway, but I think again, AI is not just happening in healthcare, it's happening everywhere. So it is going to be something that we all have to figure out, whether it's the way that the education system or colleges change, curriculums change. I mean, I have an 8-year-old and he has ChatGPT like as part of like something they teach in 3rd grade. So it is going to be something that I think is going to be rather pervasive. I think we heard a little bit about this earlier today, and I certainly heard about it at dinner last night. Does the way that we train physicians, does medical school curriculum, does it need to change? It seems like it hasn't changed that much. And then what I was hearing at dinner last night is what physicians are taught in medical school and what they're sort of, going back to the incentives, how they're trained. There are gaps because when you're actually in it and you have to do things, you're doing things that are not the way that you were taught in school. So there are these dichotomies, and I think it's important to bridge those, and I think AI and technology is just a part of it. But it is, I think, novel that, starting with things like starting the ambulance, get into the patient's home, see some of these things, because it comes back to what you said, that human element, that connection, and really understanding what it's all about. It's so important, and how could we bring that in more and more? And do we need to do it earlier? Do we need to do it in different ways?
Yeah, and for each member of the care team, appreciating that everyone's bringing a certain element of that care. It's a team-based sport, and we all have an obligation to that human being. Darlene?
I would, like Eric Topol, I think the title of his book, How AI Can Make Healthcare Human Again. And I think if we cautiously deploy it, and we make sure that innovative things that are happening, Dr. Battinelli should have a mind meld with other deans from medical schools, because medicine is a naturally conservative, very slowly plodding, detail-oriented arena. And we do need to be open to things that are going to improve care, that are going to come at us rapidly, which is why 2 engineers who were physicians created Vista, right, in the basement of a Veterans Administration hospital. The first EHR was created by docs who were engineers. So we need to make sure we're engaging the people on the front lines of this, not just the practitioners on the front line, to help to decrease their administrative burden and increase their time. But we also need to make sure we engage the patients.
Terrific. Well, you both have given us so much to think about, particularly as we venture out into the sort of days, months, years to come on this very exciting topic. Thank you both.